when we want to diagnose someone with autism, there are a few things that we have to keep in mind. So these are the things that we refer as differential diagnosis. This is to make sure that we give a accurate diagnosis to children with autism. Okay, to make sure that you don't misplace this child in normal class and things like that. So the first and foremost, of course, the hearing impairment, visual impairment, selective mutism. Okay, that's why in the pathway that I shared with you just now, the second step is actually to rule out all these medical conditions, to rule out any hearing impairment and visual impairment. You know, like, because one of the symptoms of autism, when you call the child does not respond to you. So you don't know whether the failure to respond to you, is it because of the child cannot listen well or because of something else. Okay, so that's why it is important to rule out this medical condition first. Okay, so if you suspect it, that your child, sometimes it happens where we miss out this step, this rule out hearing and visual. So it's good if the doctor forgot to refer. It's good if the parents can, remind them to refer them to to rule out this hearing and also visual impairment. Okay. And selective mutism is a condition where a child refuses to talk. So it's not like the child cannot talk, but refuse to talk to other people. They usually will talk to very limited people, normally family members. It can be mother, okay? It can be mother and father, it can be brother. So it is important to make sure that if a parent comes to us and say, oh, my child don't rarely speak. So it's important to differentiate rarely speak because of the autism characteristic or rarely speak because the child has selective mutism. So with a selective mutism, in the clinic, they hardly respond to the doctor. But if they want to answer, they will whisper to the parents their answer. Okay, so that is the difference between having a speech delay or having a autism symptoms or selective mutism. Okay, so another thing that we need to bear in mind, okay, to make sure that we have an accurate diagnosis of autism is actually to rule out speech delay. Because symptom of autism, communication is not the only characteristic or symptom to say someone has autism. It also, the other area that you need to look into is behavioral or repetitive and restrictive behavior. So if the child only has communication issues, so my child don't talk, but have no problem playing with other kids. You know, if you scold him or her, she understands. Even if I angry and show my anger face, and the child understands. So most likely the child don't have autism, but only have speech delay. So if the child don't have autism and only speech delay, so you only need to refer to speech therapist instead of send to EIP and things like that. Another diagnosis, I'm not going to discuss all, but another important differential diagnosis is ADHD, attention deficit hyperactivity disorder. Because some autistic kids, they are quite hyper, they are quite active. Some is quite slow, like play quietly by their own and things like that. So it's important to differentiate whether this hyperactivity is it part of autism or the hyperactivity is part of the ADHD symptom. Okay, you don't have to worry about this unless you are a doctor. So it can come together as well. You know, you can have autism with hyperactivity. We call this condition as comorbidity. So it can be autism alone, it can be autism with something else. Okay, all right. Okay, now for treatment and management. So when it comes to treatment and management of autism cases, so it involves a multidisciplinary. So we have pediatrician, we have psychiatrists, child psychiatrists. So especially when it involves medication. If like the child needs medication, normally if the behavior is too you know, like some autism kids, they hypersensitive to things, and sometimes they like to bang their head on the wall and things like that just to get a sense of things. So some of this behavior can be dangerous, some can need to be controlled by medication and things like that. Okay, and then we have clinical psychologists, educational psychologists, counselor. So clinical psychologist, occupational psychologist, speech therapist, occupational therapist, speech therapist. These are the teams under the EIP. Okay, like I said before, some EIP programs have clinical psychologists, some don't have one. So occupational therapist for the behavior part, speech therapist for the communication part. Okay, we also involve social welfare services. This is for the OKU card application, and also educational officers for the school placement of the child.